Hi, my name is Kalia Miller, and today I'll be talking to you about the history and treatment of bipolar disorder. First, you need to know a little bit about bipolar. It is also known as manic depression and depressive illness. There are two extreme causes of mood swings, mania and depressive episodes. There are three different types: bipolar 1, bipolar 2, and cyclomatic disorder. Their mood swings occur rarely, multiple times a year, or not at all. They can affect an individual at any point in their life. It first emerges during a woman's pregnancy or after birth, usually diagnosed in teenage years or early 20s. There is a reduction of 9 years in lifespan due to 1 in 5 patients committing suicide. So here are some facts about bipolar disorder, and it affects 2.8 people in the United States, 5.7 million adults, 1.1 million children and adolescents. It's the 6th leading mental health disability in the world. There's 82.9% of people who had serious impairment and 17.1% who had moderate impairment. And unconscious gender bias is used when diagnosing patients. Women are more likely to be diagnosed with depression. Men are more likely to be diagnosed with schizophrenia. In early findings in history, meaning the 300 to 500 AD, people were put to death due to spiritual and religious beliefs. They believed that they were crazy or possessed by devils and demons. Due to this, they were restrained, chained, their blood was let out, and given potions or electric eels were applied to their skulls. Ancient Greeks and Romans applied the terms mania and melancholia. In northern Italy, spas and lithium salts absorbed into the body for treatment. In the Middle Ages, people with mental illnesses were guilty of wrongdoing due to belief that their illnesses were manifestations of bad ideas. In later findings in history, in the 1800s to 1900s, psychiatrists were further studying and researching. A French psychiatrist identified manic and depressive episodes. There was another researcher recognized the difference between bipolar and schizophrenia. In the 1950s, experts created the Diagnostic Statistical Manual of Mental Disorders, or DSM, to properly standardize and categorize mental illnesses. So now we move on to the different categories of bipolar disorder. And the first category is mania and hypomania, which are emotional highs. They can trigger a psychosis and which means a break from reality. Mania is more severe than hypomania because it causes noticeable problems at work, school, activities, and relationships. You can be abnormally happy, wired with increased activity, energy, or agitation, exaggerated sense of well-being, and self-confidence. The second category is depressive. These are emotional lows, feeling sadness, hopelessness, loss of interest and pleasure in activities, increased or decreased in appetite, causing significant weight loss or gain weight, affecting sleep schedule, causing insomnia or sleeping too much, the decreased ability to think, concentrate, or indecisiveness, think about, plan, or attempt suicide. There are 3 known types of bipolar disorder. Bipolar 1, where you have to be diagnosed with at least 1 manic episode followed by 1 hypomanic or major depressive episode. Bipolar 2, you have to have at least 1 major episode and a hypomanic episode, but never a manic episode. In cyclomatic disorder, you have to have at least 2 years of many periods of hypomania symptoms and periods of depressive symptoms. Here are some mental health related problems: anxiety, ADHD, eating disorders, personality disorders, schizoaffective disorders, misusing drugs and alcohol, thyroid diseases, migraines, heart diseases, diabetes, and obesity. There are biological and environmental causes. Chemicals affecting the brain are noradrenaline, serotonin, and dopamine. Noradrenaline and serotonin are linked to psychiatric mood disorders. Serotonin connected to sleep, wakefulness, eating, sexual activity, learning, and memory. Dopamine regulates nerve pathways within areas of the brain responsible for pleasure and emotional reward. When circuits are disrupted, they are linked to psychosis and schizophrenia. Environmental stressors can trigger bipolar disorder for those who have genetically affected. Genetic disorders, or genetic causes, are traits passed down through parents. First-degree relatives of a person diagnosed with bipolar 1 or 2 are at an increased risk for major depression. If one parent has bipolar disorder, there is a 10 to 15% greater chance of a child developing bipolar. If both parents have bipolar, their child has a 30 to 40% chance of developing the disorder. When left untreated, results in problems that affect different areas in your life, including drug and alcohol abuse, suicide, legal and financial problems, damaged relationships, poor work and school performance. Here are some specialists that you can see when you need to seek help. Primary care doctors, psychologists and mental health counselors, and social workers. Primary doctors provide basic initial assessments, medication treatment for common depression or anxiety. General practitioners, family practitioners, and pediatricians all fall under the category of primary care doctors. Psychologists and mental health counselors provide psychotherapy, which helps avoid long periods of mental illness and hospital stays. Neuropsychological and psychological testing can help clarify diagnosis. Social workers use talk therapy but cannot prescribe medication. Now moving on to the diagnosis of bipolar. First, you receive a physical exam, then a psychiatric assessment, and the physical exam includes a thyroid function test, which measures blood and how well your thyroid glands function. The thyroid produces and releases hormones, hypothyroidism, resulting in problems with depressive symptoms. In the psychiatric assessment, the doctors will ask questions about one's thoughts, feelings, and behavior problems. Risk factors including family and medical history and drug abuse. Diagnosis requires at least one depressive episode, one manic or hypomanic episode. They also consider the DSM when diagnosing patients. Now we move on to treatments. Treatments are very important because without treatment, you can further your symptoms. Medications include mood stabilizers, antipsychotics, antidepressants, and anti-anxiety. Mood stabilizers control manic or hypomanic episodes. Antipsychotics, if symptoms of depression or mania do not stop with mood stabilizers, are diagnosed. Antidepressants manage depression but can sometimes lead to triggering manic episodes. Anti-anxiety help with anxiety and improve sleep. This is only prescribed for a short period. Never stop taking your medications due to higher relapse of symptoms. Minor mood changes can turn into full-blown mania or depression. There are continued treatments that doctors offer when your symptoms have not stopped. There are day treatment programs, substance abuse treatment, and hospitalizations. Day treatment programs provide support and counseling needed while getting symptoms under control. Hospitalizations are recommended if extreme mental health conditions worsen. If behaving dangerously, feeling suicidal, or have become detached from reality, hospitalizations are recommended. Psychotherapy or talk therapy is also recommended for continued treatment. Interpersonal and social rhythm therapy. It focuses on stabilizing daily rhythms such as sleeping, walking, and meal times. Cognitive behavioral therapy, or CBT, identifies unhealthy, negative beliefs and behaviors and replaces them with healthy, positive ones. Psychoeducation is the learning of bipolar disorder and provide help for individual and families. Family-focused therapy uses family support and communication to help individuals about what is going on, the best support, and identify issues and concerns and plan to prevent relapse of symptoms. In conclusion, the history and causes, problems related, and diagnosis and treatment are all important to understand the topics of bipolar to move forward in developmental treatments. The more we know about the disease, the more we are able to help those in need. Thank you.